Hi, welcome to Wellness Wednesday. I'm Dr. Jessica, the naturopathic doctor here at the Coach House. And today we have Jillian Sauder, our physiotherapist, one of our team members, here to talk a little bit about herself and her practice. So when it comes to physiotherapists, there can actually be a decent variation in how they practice and the modalities they use. So can you tell us a little bit about how you practice?
Sure, Jess. Well, I tend to consider myself more of a manual therapist, meaning that I use a lot of hands-on treatment techniques. I definitely think it's really important to use those techniques to get in and mobilize the joints and reduce tension in the soft tissue, the muscles and connective tissue. I also consider myself to be a little bit of a hands-off physiotherapist in the sense that I think it's really important to give patients not just corrective exercise, but also a lot of education and lifestyle tips to help correct the issues that led to the injuries that they're coming into physiotherapy for.
So you don't just do basic physio, you're also a pelvic floor physiotherapist.
That's true. I do pelvic floor or pelvic health physiotherapy. I've been doing that for about 1.5 years now. It's been an interesting road. I got into that because I basically just got really frustrated by having patients telling me that they were having bladder leakage issues and their doctor said, "Oh, you're just getting older." And I just knew that wasn't the answer. So finally I just got fed up and decided to go out and learn about pelvic physiotherapy.
Awesome. Okay. It can treat some bladder issues or if there's incontinence, but what else will it treat?
Yeah, so like you said, there's a variety of bladder issues, leakage problems that it can treat. Also, there's a condition called pelvic organ prolapse, which is common among women who've had babies, especially multiple babies. Basically, the pelvic floor, I'll show you a diagram of the muscles in the pelvic floor.
So this is like a down view, right?
Downward view. So if you imagine, actually let's turn it this way. If you imagine this would be your tailbone at the back, pubic bone at the front, these are all the muscles that make up the floor of your pelvis. So you can see there's a lot of different muscles that sling around the vaginal and rectal openings as well as lining the base of the pelvis. So these muscles help to control your bowel and bladder function, which is great, but they also function to make a support for all of the organs contained in your pelvis. So when you don't have that support or it's inadequate, what can happen is the pelvic organs can start to migrate downwards, let's say, which is not a good situation. So that's a condition that we can treat as well as pelvic pain. There's lots of types of pelvic pain, and the pelvic floor muscles, as you can imagine, like any other muscles, can be really tight in a tightened state, which can lead to a lot of pain and tension issues, just like any other muscles in your body. So those are some of the conditions that we can treat with pelvic floor.
So you would see a lot of either postpartum women or women who, even during pregnancy, they can see you.
Yep.
Would you recommend all women that have had babies should probably check out their pelvic floor health?
You know, in France, it is standard that women after having a baby have 6 weeks of pelvic physiotherapy. A lot of strain for a prolonged period of time. Yep. So definitely that's the standard in some countries, and I think we're slowly getting there. There's also a lot of really good research about pelvic floor physiotherapy after pregnancy, but also before doing any surgery, like hysterectomy type surgery to help with pelvic organ prolapse. You can get in before having a baby and start working on that, and then as well 6 weeks and on after delivery we can start pelvic floor work as well to start retraining those muscles. So, but if you have waited and say it's, you know, years later, we still can get in and do lots of great work to retrain the pelvic floor and strengthen that up. So don't worry if it's not like right out of the gate there. So.
And it is internal work.
It is internal work. So as you can see, these muscles that we looked at before, they're internal muscles, right? They line the inside of the pelvis. So the only way that we can access them, I'm going to get really graphic, is to go internally. Right? Yeah. So unfortunately, that's the necessary evil with pelvic floor physio.
I think once you've had a baby, your modesty kind of goes out the window anyways. Let's be real.
Yeah, true enough. So just like any other muscles in the body, if you wanted somebody to work on your shoulder or your knee, you'd have to actually get to those muscles to be able to properly treat them. So we do internal vaginal and rectal exams.
Perfect.
So yeah.
Because men can benefit from this too. It's not just for female health.
It's not just for women. Men can have issues with bladder leakage, and after prostatectomy, they can have issues as well that we can use pelvic floor physiotherapy to help improve those bladder issues. So.
Now we have a blog post coming with this video that Jillian wrote too. That's about I never say it right. Diastasis recti.
Perfect.
Yes. Can you tell us a little bit about that? Because that's something that's common after pregnancy as well.
Yeah, it can be common. Diastasis recti is a condition where the abdominal muscles, so the muscles in the front of the abdomen here, there's a band of connective tissue that connects the two sides of them. And with diastasis recti, those two sides of the muscles kind of separate because the tension on that connective tissue is so much that it stretches it out. Now, this doesn't happen in everyone, and there's additional reasons that lead to it. It's not just about carrying the baby, but as you can imagine, that adds a lot of stress. So if you have had that happen during your pregnancy, it is important to get in and see a therapist who's trained to help treat diastasis recti in order to help reduce that separation in the abs so that you can have happy, healthy, functioning abs.
Yeah, because if you have the baby and you sit up, then you see that it's that bulge, right? Like you see the bulge
You'll
in between.
see a bulge, and you'll also see a bit of a dip. So if you were to lay down on your back and lift your head up, your fingers will actually dip right in between the
So that's like your internal organs pushing outwards.
Well, it can be. It can be. In severe cases. Yeah. For most women, you won't see that. You'll just see a little bit of a groove.
Dip. Yeah, it depends how severe it is.
Yeah,
but it's rated, right?
Yeah. And so obviously with a greater diastasis, you definitely will have more symptoms, but we need to have the abs functioning properly because the abs work with the pelvic floor to help support our low back and pelvic stability, as well as they play a big role in our continence, our bladder issues or lack thereof. So yeah, definitely important to deal with that if you're having those symptoms.
And Jillian can help treat all these things. Okay, so thanks for watching. Hopefully you learned something from this. Of course, if you have any questions, you can always book in with Jillian or send her a quick email, and we'll be back in 2 weeks for another Wellness Wednesday. Thanks for watching.